Welcome, everyone. I'm Dick Deming. I'm Medical Director of the Mercy One Cancer Center and the founder of Above and Beyond Cancer. Welcome to our weekly cancer education series. It's brought to you in part by a grant from the Iowa Oncology Society. Our topic tonight is radon in Iowa, and I have two wonderful guests with me. So sitting next to me is JulieWeisshaar. She is the Executive Director of School Radon Training and Support Systems. And next to her is my friend Maria Steele. Maria is a nurse practitioner and has come to become a radon expert. Not that that's what she always wanted to be when she grew up, though. So welcome.
Thank you.
So before we talk about radon in Iowa, let's get to know each of you individually. So Julie, tell us a bit about yourself. Where did you grow up?
I grew up in Cedar Rapids,
Okay.
so I am an Iowa girl. I live in rural Union County now in southwest Iowa in Creston.
In Creston.
Yes.
But you grew up in Cedar Rapids, went to high school in Cedar Rapids?
Yep, Kennedy, JFK.
Okay. So what was your claim to fame in high school?
My claim to fame in high school?
Yes.
Oh, you were serious about that beforehand.
Yes, yes,
Think
yes.
you were serious.
You've had like 3 minutes to
True. Oh my gosh.
claim to fame in high school.
Claim to fame in high school.
Music,
I
sports,
was in swing choir.
homecoming
I was
queen.
captain. I was not home. I was definitely
Okay.
not homecoming queen.
captain
I'm
of.
Captain of our dance squad. So our
okay.
pom squad. So
Okay,
I
there
suppose
you
that
go.
was our.
So you had good
claim to
pom
fame.
poms
Yes,
in high school.
in high school. Hey, hopefully they're still pretty good.
and what did you do when you graduated from high school?
Went to University of Iowa.
And what was your very first major?
My first major, my undergrad is in communication studies, actually.
Okay.
And then I kind of went into the education world in Iowa after that. My master's is in community development. So kind of been developing all of that into some energy efficiency training for schools and then also some school radon testing training. So being able to develop and create things has been my claim, I guess, to fame.
And right now you're executive director of a 501c3
Yes.
that works with schools around energy efficiency. And then we're also going to learn you brought radon mitigation training evaluation into the mix.
Yes, because our schools were really right now more focused on the radon piece because that is so important. Our school members said we're happy to we want to keep our kids safe and our staff and community safe. We just don't know how. Is there a way that we could be taught to do that testing ourselves? And so that's when we went out and got the training and created the system so that it can be a part of their regular maintenance.
Right.
It doesn't have to be a thing that you hire.
And
folks.
you're not for profit. How many school systems in Iowa do you are you involved with?
So far, we've got roughly 170 of the 300 and I think we're 32 schools. So, we train them how to do their own testing, and then we support them through the whole process.
Okay, and we're going to get more into the details. Maria, let's get to know you a little bit better. Where did you go to high school?
I went to high school at Dowling.
Okay,
Here
and
in
your
Des Moines.
claim to fame in high school?
I really liked sports. So ran track, did basketball, did a semester of gymnastics, which was kind of a joke as a sophomore, but there were no other sports. So Title IX brought basketball to the big schools.
And when you played basketball, was it the six
on
person?
six.
And were you offense or defense?
Defense.
Okay. And did you get to go to the state tournament?
We did not. We were not that good.
Okay.
We had just started the program.
And then what did you do when you graduated from high school?
I actually went to Mount Mercy for nursing and graduated there with a BSN in 4 years. And that was
Yeah.
the
And
next
then
step.
you practiced as a nurse for many years, and then you became a nurse practitioner.
Yes. I worked mostly in critical care areas, almost 20 years in the emergency department, and kind of thought I'd like to do something more and be independent. So I went to the University of Iowa for my master's degree and graduated from there with a master's in nursing in 2001. And then passed the national board certification for nurse practitioners, and then found a job with a great group of doctors called, and still is called, Iowa Digestive Disease Center. So I worked there almost another 20 years.
Wow. great. And then a life-changing event happened in December of 2019. Can you share with us what happened in 2019?
I'd had a cough for a couple of months that just didn't seem to go away, and went through some other cardiac testing because our family has a history of heart disease. Everything came out okay. And then the cough continued. So my husband was kind of adamant. He said, just go get it checked out. I wasn't sure what else it could be. But I did. And a chest x-ray soon led within a week to a diagnosis of lung cancer, stage 4 lung cancer. So
right. And here's
as a never smoker.
Maria, never smoker, healthy, fit, active,
not on any
cyclist,
prescription meds.
and all of a sudden, wham, stage 4 lung cancer. When did you first learn then about the association with radon and lung cancer and the association of Iowa with radon?
Yeah, that's you'd think in nursing I would have heard about it. And I had heard of radon, but the association came when I was seen by Dr. Barron after the first of the year, after I had a brain scan and told I also had brain metastasis, along with the lung cancer and bone metastasis. And I was really kind of incredulous to think, how can it be lung cancer as a never smoker? So he suggested the possibility of radon. You're my radiation oncologist. You and I talked about that as well. But it really led me to the internet to learn more about it, because I did not realize how prevalent radon was in Iowa, and that we are number 1 in radon incidence in indoor residences.
Yeah. So I'll throw this up to either of you to talk about. Tell us, what is radon, and why does Iowa have a high incidence of radon?
I'll take that. So radon is a natural gas. It comes up from the earth. And so it's everywhere. It's even outside. The EPA has set a level of 4, they call it picocuries per liter, as the action level. Outside, even outside, it's a 0.4. So basically, we just need to make sure it doesn't get stuck in buildings to where it builds up to a dangerous level. It comes from the decay of uranium. We were talking about high school earlier. I was not a fan of chemistry. So if somebody would have said, hey, you're going to be working with this thing that's on the periodic table as a part of your living, I would have told them they were crazy. But it is a decay product of uranium. And one of the products is radium, also on the table, and then it decays into radon, which eventually decays into lead, which is interesting. But so we just have to.
Good point, just to emphasize, this isn't a pollutant. It's not from industry. Right. It is part of the way the earth is made. It's naturally occurring, and it happens to be because of the way the glaciers formed the upper Midwest, and that we just happen to be on kind of a bed of radon beneath us that seeps up naturally.
Yeah, our soils kind of allow it, to come up. And it is an issue across the whole U.S. Really, Canada has a real issue with it too. Alaska, some of the numbers I see, Alaska is actually number 1. But yeah, it's a natural thing. So it's just about being aware of it and testing for it. It's really easy to fix. So in terms of prevention, it's one of those things that we just encourage everyone to do.
And so radon, naturally occurring, the way the earth was made in the upper Midwest, it tends to be very high here, but also in Alaska and some places in Russia and Europe. But the upper Midwest and the lower 48 tends to be where it's at. And it comes up through the earth. And most homes in Iowa tend to have basements. You get out to places like California and they don't have basements. But we tend to have basements, and that's one area where it can accumulate. But it doesn't have to be the basement.
Right.
But the lower the level, it's often not a problem on the 25th story of a high rise. How does one know if they have an amount of radon in their home that exceeds the safe limit?
Well, it's very easy to test with just a little test kit that I should have brought one with me. It can look like an envelope. It can be just a very simple thing. There are electronic meters now too. And there actually is no safe level. even
Good
though
point.
the EPA set 4, that was not really a medically based number. That was just at the time in 1986 or 6 or 7, when this became an issue here, more of an awareness level, they just felt that's what realistically we could bring it down to. The World Health Organization actually has the number of 2.7 as theirs, but we stick with the 4. So the way that we do it is we test it, and if it is above that, usually you try 2. You have to average those just to make sure nothing weird happened with that.
And before you get
average.
into mitigation,
Yes.
explain again the testing. So where could someone get a test kit?
Yes. So they do have test kits that you can buy just in a hardware store and things like that. You can also order one online through radon.com or the state. And typically it costs, right now it's around $18, $19, $20 usually.
Okay.
And that includes shipping to the lab. You do need to ship it to the lab. For schools, officially you only need to hang it for 48 hours in a house. You would just need 1 per 2,000 square feet. In a school, you have to have 1 in every room, so that it gets a little bit more complicated.
So in a home,
House is easy.
I would buy the $20 kit. Would I go hang it in the basement?
If you would hang it at the lowest occupied level. So if you have a basement that you are never in, or it's not even occupiable, you wouldn't have to actually worry about that. So you would place it at the lowest occupied level.
Where you have
With doors and windows shut.
with the doors and windows shut.
Well, yes, just regularly. So
You can go
in the
in
old
and out,
days,
though.
yes, you can go in and out. In the old days, they would say, do it on the weekend when nobody's home, shut everything, don't open your outside door. That's not the case. We really want to know what the radon level is when it's occupied.
In a real
It doesn't really matter
real
what
life
it is.
situation.
Yes,
Yeah.
it doesn't matter.
And then you leave it there for
A minimum of 48 hours.
Okay.
And then for schools, we have them leave it out for the week. They hang it out Monday morning, pick it up Friday morning, just to kind of get a
so it
better
could be
average.
longer than
It can be
48.
longer, but no longer than that week. So very easy.
And then you just mail it in,
Yes.
and the results are mailed back to you.
Right. And you just need to be sure there's some great instructions that come along with that say, don't hang it in direct sunlight, don't hang it within a foot of a door, you don't want to have false highs or false lows. You want to get a good reading. So there's just a few little tidbits like that.
And then when the results come back, then if they exceed what the EPA says are acceptable levels, then how does one bring the
Bring that
levels down?
So we would suggest, first of all, doing one more test just to average. So a national protocol is just to make sure, by having the 2 and averaging them. But assuming that still comes back elevated, in Iowa, there are licensed mitigators and also licensed measurement folks too. So if you don't feel comfortable doing your own testing, there are people you can call and hire to do that as well. So, but it is actually very easy to do. So the licensed mitigator, you would just give them a call and say, here's my number. How can we fix this? In a home, typically you do need to install a mitigation system, which actually is just a PVC pipe, one of those little white pipes. It's 6 inches usually. They just drill into the concrete that is below your house, and they vent it straight out 10 inches above the highest opening in your home so it doesn't come back in. And so basically you just bypass your home so the radon can't get
And does
stuck.
that go up the outside of your house?
It depends. It can go through the inside. So we tested our own home. I figured I better walk the talk, right? And we actually had a slight elevation. We were able to actually bring it up through the middle of the house because we had a spot that was easy for them to take it up through there. And that is preferable if you can kind of to get it in the center of the home so that you can kind of pull as much as from underneath the foundation as you can to get out. But sometimes, especially with schools, we end up having to put it up the outside. Depends on the roof and how new the roof is and the warranty and all that stuff. But for homes, your mitigator will ask you a bunch of questions. Where are the footings of your foundation? And, where they figure out where they can throw it with your electric lines. You have to have a place to plug in your fan because there is a fan attached to that so that it can pull the radon up. In newer homes, sometimes now they can add a passive system that basically is the pipe ready to rock. and it can vent naturally. And then if you do test and have an elevation, then all you have to do is add a fan. So,
Gotcha. And
it.
on average, and I know it
Mhm.
depends a lot on the circumstances of the home, but on average, what's the cost of mitigating a home?
It ranges right around probably between $2,000 and $3,000, I would say.
Okay.
It depends. And that would be like just a simple, basic job. My mother-in-law's home, it was an older home and didn't have concrete throughout the whole basement. She had a crawl space that was exposed. So basically they roll out, I call it thick saran wrap. They roll out this thing that seals that without having to pour concrete, because that's just really expensive. But so of course that adds a little bit more, to your cost.
Okay.
But you have to seal all of that so that your system can work.
Gotcha. And I should have started with this earlier. We did. We touched on Maria's lung cancer, but why should we worry about radon? And one of the reasons is that radon does cause health consequences.
Yes.
And the most notable of those is lung cancer.
Right.
It's the second leading cause of lung cancer, second to cigarette smoking.
Right. And leading environmental cause.
Yes,
So,
the leading environmental
Yes.
cause. What other health consequences are caused by radon?
So far, that is the only one there is really strong evidence about is lung cancer.
Yeah.
I know there is some research being done about, because it happens. One thing I did not say either is the only way that you can know if you have it is to test, because this thing that comes from uranium and comes up from the ground is invisible. There is no scent to it. There's no taste to it. There's no way to know that you have it unless you test. So that's kind of an important thing too, because a lot of times people think, well, I don't smell anything, so I don't have radon. And now I lost my train of thought.
But we were talking about the health
What he said.
consequences.
Oh, yes.
So I recently did a literature review on, it wouldn't surprise me, knowing radiation biology and how radiation can cause cancer, that we may learn that there might be other cancers that are also at higher risk for people who, so right now it's the only proven one, but there is some thought that it could contribute to some leukemias and possibly kidney, bladder, colorectal, possibly.
And I do know, since the way that it really gets in the body is by breathing, basically, so it's not the gas itself that is the culprit. It's when it decays into radon decay products, it's kind of like little dust that you kind of breathe in and then it gets stuck in your lungs, and that's carcinogenic. So there's also, I know our friend, you knew Dr. Field, Dr. Bill Field had started to do some research on whether there was anything with the brain.
Sinuses.
Yeah, in the sinuses, but we don't have any good research yet.
Yes.
So,
Okay, so we have talked about radon in Iowa, and that we are sitting on a large amount of radon, and that it is a public health problem in Iowa. We talked about the consequences of radon exposure, primarily lung cancer as the number one environmental cause of lung cancer. We talked about testing. We talked about mitigation. Let's talk specifically, and you've been talking about schools. Let's say talk about why we're talking about schools. So back in 2022, and Maria, let's bring you back into this conversation because you were there, and I remember your granddaughter Penelope was there at the signing of the bill.
Yes.
But in 2022, we finally got a radon bill passed. If anybody's been involved in advocacy and public policy, you know that sometimes it takes years to get a law across the finish line.
yes.
And a friend of ours, Gail Orcutt, who was also a patient of mine, who was a teacher, never smoker, with stage 4 lung cancer. And Gail led the charge year after year for probably at least 5 years in a row up at the State House, trying to get a law passed to help reduce the burden of cancer caused by radon. Gail, unfortunately, passed herself in about 2021. And it was in 2022, Maria took the baton figuratively from Maria and
Gail.
from Gail, excuse me. And Maria was up there leading the charge with the legislators. And finally, in 2022, got the law passed, which was named in honor and memory of Gail Orcutt. So the Gail Orcutt School Radon Safety Act was signed into law in 2022. Maria, tell us a little bit about your memory of the activism and advocacy that you were part of that eventually got the bill passed.
Well, it was quite an experience because when I was diagnosed, as you said, late 2019, and I had read a lot about Gail Orcutt, and she had given a lot of interviews. And one thing that just amazed me was the fact that here she had stage 4 lung cancer, and yet she is still up at the State House. I think this is correct. She had a lung removed, she had her hip replaced, and yet she is still up at that State House interviewing legislators and telling her story. And as a nurse practitioner, stories are important, but so is advocacy. And so it took me several months to kind of get the courage to even talk about it, but I had a lot of help. I had joined the Iowa Cancer Consortium, the American Lung Association, American Cancer Society, Cancer Action Network, which is all about legislative priorities. And I had a lot of really good mentors. This was not just something I showed up one day and started talking about, because I didn't realize the importance of talking to legislators about a personal story. I get it now. And how can a legislator argue with your personal story and how it has affected you? And it's something that I just couldn't believe that radon was so high in Iowa. So I thought that was something they needed to hear about it. And, we've all gone up to the State House, and it was a good experience, kind of scary at times, but, I testified in subcommittee hearings, and, that's not the easiest thing to tell your story, I will say. As a nurse practitioner, you're listening to people's stories, they're telling you about their problems, and I don't start in on, well, here's how my day's going, so, you just kind of put yourself aside. So, but it was a different experience for me to tell my story in a very succinct way and hopefully make a difference. And because of the people I had behind me and with me, I think as a team, we made a difference.
Mm-hmm. Yeah, I'd like to say, as a nurse practitioner, as a doctor, we can help reduce the burden of cancer, one patient at a time every half hour through the day. But if we're up at the State House and we pass a piece of legislation, we might impact thousands, if not millions of individuals with that sort of work that we do.
And I will tell you a little story. It helps to have a cute granddaughter. So there was one time we watched our now 3 grandkids, but at the time Penelope was just, a year or 2 old. And so she didn't mind tagging along. So we'd take her up with us. And there was one time I was holding her and a legislator said to me, "Are you looking for somebody? Oh, isn't she cute?" And I told him who I was looking for. He literally yells across the floor, "Hey, come over here. Come talk to her." And Penelope's like, "Why is he yelling?" But they're like, "Oh, it was just, I think it broke up their day." Yeah. But it was just, it's a lot of fun.
And I think people don't understand, number one, how easy it is to go up there and to engage your legislator in conversation.
I did not know anything about that.
And then even to the point of testifying at a subcommittee hearing or a committee hearing. And as you pointed out, the impact of that testimony, when individuals like you are up there talking, you are telling personal stories with no personal motive other than to impact public health. Whereas, I'll make an exaggeration, but practically 90% of lobbyists that are up there for their clients, it has something to do with money and who's going to get what amount of money. And
right.
And when when you're up there, it has nothing to do with money, and it has all to do with public policy to help the greater good. So cancer survivors in particular up there testifying, I mean, they have white hats on. And the politician, I mean, there's a Democratic caucus and a Republican caucus, but there's not a pro-cancer caucus and an anti-cancer caucus.
Right.
Everyone
It's bipartisan.
has public health as a perspective, but when it comes down to competing bills, it does make a difference to have cancer survivors giving their own personal testimony.
Yes.
And this did pass almost unanimously.
Yes.
did.
So ironically,
Yeah.
I can't remember exactly, but maybe 4 years in a row, it never even made it to the full Senate or
Right.
House for a bill passing because it couldn't get through the subcommittees. And then all of a sudden,
That was shocking to me.
it went
Why-
all the
how
way
it took so
through and
long.
was nearly unanimous,
Yeah.
if not so.
Yeah.
And this particular bill, so
Mhm.
this bill is not a perfect bill. And the bill that we were able to pass in 2022 is the Gail Orcutt School Radon Safety Act. So it only pertains to schools, not to homes.
And public
Public.
schools.
And public
Schools.
schools.
Yes.
Yes.
Yeah.
And it also doesn't have any particular funding mechanism
Right.
with it.
Right.
So it mandates that the public schools test.
Mhm.
Once every 5 years.
Mhm.
Mhm.
And it doesn't actually, does it mandate
Mitigation.
Mitigation?
Yes.
Yes. it
testing
does.
and
It found
mitigation?
it
So
has
it
to be.
mandates,
Yes.
but there was no funding that comes
Right.
with that.
Correct.
And no obvious penalties if they don't
Right.
do the
It says that
testing.
both the Department of Health and Human Services and the Department of Education would work together on that. But a lot of times it's sort of like, who's responsible?
And who's it
You know?
reported
who's
to?
responsible for
Yeah.
keeping
They
for
need to
making-
put it on their website. So
Yes.
so you can check, you can go home, you can check to see if your particular public school has posted their results on the website. And just, that's just one way. And that was a way that, as Gail, she and I talked a lot, before any of this was written up, just to be like, how can we write this in a supportive way that also doesn't let schools off the hook? And, we want to make sure that they're, they're doing what they say they are. So it is an unfunded mandate, which of course wasn't popular with schools, and public schools are getting cut and cut and cut. So that was tough. But again, I love your quote of "Don't let perfection be the enemy of good." Right.
That's right. Yeah.
So by getting it in there and then finding ways to support them, it was better than not.
And Julie, share with us some of the results. So you work with 171 public schools in Iowa. Do you know the results of those 171?
Yes.
Have they all tested?
They've all tested or are in the process of testing. So they have to have every one of their enrollment centers. So anything that has students in them tested by July 1st of 2027. We suggest that they test every building, even their administrative buildings, because everybody is important, not just our students. But so yes, they've all tested so far. Because schools are typically built a little bit more quality in a more quality way than homes are, and have multiple ventilation systems and things that our homes really just don't have, right? There aren't as many elevations as we thought there would be. However, there are some, so we've had right up front about 45% have a need. They have at least one elevation and need to do some follow-up testing or corrective
But
measures.
that's pretty significant.
It is
45%.
Yes. And it's,
Yeah.
and that's just usually just one room in one corner of a wing, it's not like a whole,
Okay.
a whole building. So we help them brainstorm. We look at their foundation. Are there any cracks that are obvious that, radon could just have a straight chimney up into the building? Is your ventilation working the way it's supposed to? Some of those things before diving right into poking more holes in the building to install a mitigation system. So about 15% then need to go ahead and have the whole system put in. So I was just trying to do the math of how many don't, but yeah, my brain was not working right there. But so we're able to resolve it for some without having to add a system. And then about 15% do need to mitigate. So far, it's been a really positive experience. It's all about communication, upfront communication, which sometimes, especially when talking about a cancer causing thing, understandably schools are like, oh, we don't know if we want to like bring this up front. And, but we say, trust us. We've got the upfront talking points. You're telling your teachers, hey, and now it's a requirement. We've been doing this even before it was a requirement. So we've been doing this since
So some schools
2015.
were ahead of the curve and were voluntarily testing.
Right. And so at that point, when you had to say, well, why are we testing? Well, it's to keep you safe. We're being proactive. If we find something, we'll fix it, and here's the results and here's how we know it's okay. And now we are testing every 5 years just to be sure that there's not another elevation somewhere else. So it's been a really good thing. Gail just felt like, especially as a former teacher in a public school in Iowa, our schools are the center of our communities, and so it just felt like it made sense to start with them to model that positive testing behavior. Hopefully we can get that out. It's actually not a requirement even in real estate in Iowa yet.
Right. And so if we look at what might perfection look like in terms of radon control, you could go anywhere from requiring new construction to mitigate. You could require every time there's a sale of property to have testing, make it known and mitigation. Those would be ways that would gradually help reduce the risk. Do you have, and this might be outside your area of expertise, but this bill and the increasing knowledge of radon, do you think that home builders now are more interested in just right up front dealing with it, or do you know that?
Were you going to jump in?
Well, I think they are more aware just because of the big report that came out in 2024 about the rising cancer incidence in Iowa. That's huge. We're number 2, which is not good, of course. I do think they are more aware of it, but it also takes extra money to install that radon resistant construction. Although they say it costs about $200 if you're building a new home, whereas a mitigation system, when we put ours in, was $1,200. Again, that's 6 years ago. But it's always more expensive to retrofit.
Right.
So if you can do it ahead of time, and so you hope with the media giving more and more attention, and ideally family practice providers and physicians also sharing that, just like, do you smoke, yes or no? I would love to see a thing saying, have you tested your home for radon? And so, to have the health systems, make that part of their electronic medical record and all that, but that's going off on a different tangent. But I think mandates are almost like a 4-letter word in the Iowa legislature. However, this really is a requirement or a mandate. What would you like to call it? If it's for the greater good and to decrease our rates of cancer, you can call it whatever you'd like. Maybe it is truly a mandate, but I think that's an important thing to think about.
I think we are going to see some activity, as probably with the Rural Health Initiative. Iowa will be getting $100 or $200 billion for rural health, and radon is going to be part of that initiative. So there's more to come on that, but I do know that radon, in terms of testing and mitigation, not necessarily public policy that changes the laws, but more emphasis on using some of that money for radon testing and mitigation.
Well, and I think speaking of rural, many people have wells. It is not a requirement to test wells for radon or any other contaminants in the state of Iowa. It can be done free through your county. But I actually talked with our county person a few years back, and I asked him about that. Do you test for radon in our city water? Oh, of course, many other things, But he said the issue is in rural areas, people don't want to test their wells because it's reported to the government. And so they don't want, and that was his experience and his comment. But I thought if we're getting millions, if not billions of dollars, I would like to see rural water tested, because that's another way you can have radon into your home. So, and just the education out there, because until 6 years ago, I had no idea Iowa had the highest indoor radon levels.
Yeah.
Not a clue.
When you corrected the million billion, I want to make sure I said correctly 100 million, not billion.
I was thinking
Did I say billion?
I think
Okay.
so.
No, I think it's
That's okay.
I think it is
more like 40
million.
billion nationally.
Yeah.
But, what other legislation do you think might move toward having a more comprehensive radon approach to public health in Iowa?
I think construction is one, obviously. I also, that really will move forward. I hope providing funding for mitigation systems, or at least tax credits. I think there's one, I think it's House File 1027, that includes tax credits. I thought I wrote a little note on that. I don't think I did, but requiring other entities to test. I mean, Iowa City is the only city in Iowa that every resident has to test. How they got that passed, I do not know, but it's impressive because it is for the public good and it's prevention, which should be the foundation of healthcare. So I hope they can provide more money for mitigation, especially for low income, and the requirement for testing in maybe rental units as well, because all daycares have to test. But that leads me to think about private schools and homeschools. They're not required to test. So there's quite a big percentage of children that's not being checked, which I find troubling.
And they're receiving more and more public dollars now through vouchers.
Yes.
So they really,
Yes.
those children are as important as every other child. And
the
I feel like
teachers.
they should,
I mean, our daughter
follow the
works in an
same
elementary
rules.
building in Waukee. The teachers and the educators and the
Yes.
staff, all of them deserve to be safe, whether they're in public or private schools.
Because they're
or
in that
homeschooled.
room sometimes
Exactly.
for 30 years.
Right.
Exactly.
And
Like
Julie,
Dale.
with working with the schools, 171 of the public schools in Iowa, have you seen that there are more contractors doing mitigation? Have you seen that that's easier to find people that are expert at doing it? Have you noticed an improvement in that process?
Not yet.
No, not yet.
There's actually a shortage
Okay.
of mitigators in Iowa, and especially mitigators that are comfortable doing schools and large buildings. They're plenty busy with homes right now, the ones that we do have. And that's a much simpler job, I understand, So that is one area in that bill with the dollars coming down, is to kind of help encourage others to enter the radon mitigation profession, because we need more.
Okay.
Yeah. Because that is something the schools are not allowed to do their own mitigation. They can do their own testing, but not their own mitigation. So, and it's a pretty simple process. It really is just sticking that pipe in there. I mean, I'm not pretending that drilling through concrete is
This
easy
is not
or
a
anything.
do-it-yourself project.
Right. And so they do have to have a certified person. And if you don't have enough in the state, that's an issue.
Well, let's open it up to questions. So if you are watching us live streaming right now, you can ask us questions. Just put your question in the comments section of the software that you're using to watch us. But those of us in the room, our live studio audience, gets first shot.
Well, I have an interesting question. Like in homeowners insurance, like they give you the incentive, you get a new roof, you get a discount. I think that's another thing to present, would be an incentive to improving the home and doing radon, I would think too, because you are drilling too, and probably to the roof, right?
Yeah.
Right.
So that's got to be part of the coverage, I'm sure. But that's just an idea to bring about.
Sure.
So I don't know if that needs talking to other insurances, agents, and that might be an idea.
Yeah.
And another thing I was wondering about, I understand it's the earth. It's not the aging of the house, more to do with the earth. Have you found things of radon going up because there's a lot of development going on, stirring of the dirt? Has that been tested and noted?
You know, there's not a real clear way to test that. But what we have found, at least in schools, is there was a perception that old schools, because like everything else is wrong with them, that they would be higher in radon. We're actually finding higher levels in new buildings because they're more energy efficient and the radon can't get out. So that's an issue. And so in newer developments, my guess is it would mostly be that issue versus the kind of, bringing it up with the digging. But
Yeah, I think with the digging, it disperses so quickly
Mhm.
that measuring
Diluted.
it out in the open air doesn't often detect. It's such a low level once it's exposed to the open air.
And the sump pump cover was something that surprised me.
Yes.
So when we had our mitigation system put in, because I was watching everything he did, I wanted to see how it all worked. And he said, "How long has your sump pump cover looked like this?" I'm like, "I don't know." And he goes, "You need a new sump pump cover." And and then I watched how he drilled in the 4-inch PVC pipe and how he, got it through the system up through our garage roof and how the fan worked to bring it out. So, but yeah, the sump pump was something I hadn't thought about.
So I think you're implying that stuff could come up through the sump pump and that your
Right,
cover was
whatever
no
room.
longer a good seal.
Correct.
It was-
Absolutely.
Okay.
And I didn't see a problem with it because I had never heard the sump pump run in the 5 years that we'd lived there.
Mhm.
So,
yeah, and we find too, one of the corrective measures we talk through with schools is sump pump and also dry drains. Depending on, sometimes it is actually venting or the draining directly, it's not into a city system. So if you have a dry drain, there's just a spot for, air, soil, water to directly, come up into a building. So, but you mentioned the insurance thing for home insurance. I do know that Gail Urquhart and Dr. Field talked to some health insurance folks about incentivizing or doing something, for that, because obviously that is saving them money.
And life insurance. That would be another.
life
Yes.
insurance. Yes.
Yeah.
Sometimes life insurance, they're thinking of the longer an individual lives, the more money they make, and they may be interested in the possibility of incentives for individuals to have prevention. Gary, did you have a question?
I'm kind of curious. You talk about Iowa, being pretty high. How about neighboring states? Also, are they
Minnesota.
also pretty high?
Yes.
They are, and
Minnesota,
that this like
Colorado.
ranking, there's different ranking lists, and Iowa isn't always number one. The last ranking I looked at, and I don't know if it included Alaska, but it was South Dakota was
pretty
number
high.
one on a list that I saw. So, but Iowa definitely is right up there in the top 5, and probably for the lower 48, it's probably in the top 3.
And the hard thing is the way that they rank that, we only know what the tests show. So unless we have test results, we don't have anything to chart. So I know, like with AirCheck, the lab that we use, they're the ones that kind of said they get the highest levels in Alaska. So, until you have a home or a school test, there's no way to rank that because there's not really like a measurement thing that you can just go around.
I think some of the measurements are more just scientific, where the radon exists under the ground, as opposed to the percentage of homes that have a rate higher than the 4.
Right.
And I think isn't it like 70% of homes in Iowa
Yeah.
have
71, 72.
have a higher than considered
national
acceptable.
Mhm.
So it is a large percentage, and it's good to know that schools is not that high, but still 45% is a high level. Hoon.
Yes, just a clarification. We had ours tested maybe 2018. I think it was Dr. Deming's guess, and we were convinced, and so we had it done. We also had it tested in the basement where by the sump pump, but we don't spend much time down there. So do you recommend you retest your home every 5 years?
Every 2 to 5
2 to
is what
5.
they
Even with the
suggest.
system, though.
Yes,
Even with the mitigation system, you should
Okay,
check
we
it.
don't, so when we tested, it was fine, so we
Oh,
need
good.
to
Yeah.
retest.
And if you're never really in the basement, you can test the lowest occupied level.
Yes.
But otherwise, it doesn't hurt to test the basement at all. But just
Well, the
That would
HVAC
give you the
system
worst.
brings everything through anyway, you know?
right. The lower, the higher. Yeah. So you talked about like on the 25th floor, there's not an issue. So the protocol for schools is to test every room, including little offices, everything on the main floor. And then knowing that the level will be highest on the low level, only 10% of the classrooms on floor 2 and 3. Anything above that, we don't test at all. So,
And this is just the follow-up about builders. So we've been looking at houses, and we're finding that they're putting in the system.
good.
Good.
Yes,
Good.
the ones
Great to
we
hear.
have looked at.
Mhm.
I don't know if all of them, all the builders. are
And this
putting
is
them
new
in.
construction?
New
that you're looking at?
construction.
Yeah, so
Yes.
your experience is the new
Yeah.
construction you've looked at have built in.
Yes, I
mitigation.
think everyone that we looked at.
Okay.
Good.
And it's interesting because you can have the mitigation. When we had ours put in, he asked if we wanted it to be inside the home or outside the home as far as where the fan was. So we said, I think if it's inside the home, it's more protected from the
Right.
elements.
That's,
So the fan itself is in the garage attic. But after we had ours tested, and you know how word gets around, almost all of our neighbors surrounding us, some you could just see it on the outside of their home. I think it's a little less expensive because there's just the one opening and then out it goes. But yeah, it was very interesting and informing to me to get that mitigation system put in.
Hi.
Hi, Pearl.
Hi.
So, in the absence of a radon mitigation system in a home, what would be the way to mitigate radon? Like, could we open the doors and the windows and allow more airflow into the home?
No.
I mean, to a degree,
Really?
I mean, it only makes
say
sense. You're
no.
diluting it to a
No?
degree. It's
You
not
can't.
ideal.
Well,
if they
it
couldn't
would-
afford one, is that what you're asking? If you couldn't afford a mitigation system, or if
Yeah,
anybody could,
Or if I
couldn't-
haven't set it up yet.
yeah.
So,
Oh,
Yeah. So
okay.
as a long-term thing, I would say no.
Oh, and I agree with that.
Yeah.
I agree with that.
But so the reason that the windows and doors, need to remain closed during testing is because of that. It can do one of two things. It can either dilute it, or depending on the geological formation underneath your foundation, it can actually create what they call a chimney effect and pull more radon in.
Oh.
So it's kind of it's not a clear answer, but
But to check the foundation for cracks in your foundation, that would be another thing to have a person who knows what they're looking for.
Yeah.
Fill in the cracks. Again, check the sump pump.
yeah, there are
Yeah.
other ways it can be fixed,
Yeah.
but and if those aren't, then long term, we just want everyone to be safe. And
Absolutely.
it's a good question though.
Kevin.
Yes, and do you know if any researcher or any organization has taken a look at cancer data from all over the U.S. and extracted among lung cancer the incidence of cancer where there wasn't a history of smoking or any other risk factors, and attribute that to radon?
I would say there are papers that are written that are use some mathematics like that to try to predict how many, for example, Iowans have lung cancer attributed to radon. Because you can't take the cancer biopsy and send it to the lab and say, was this caused by radon? So it has to be some sort of mathematical calculation based.
You look at the risk factors and say, where are you
Mhm.
involved in the risk factor?
Yeah. Yeah. And you could, So there are some papers that attempt to do that, like what is the level of radon that is underneath the state? What are the testing? How many homes that have been tested? What percentage are above that? So there are ways of trying to calculate, but it's kind of a math statistics, not an actual this person's cancer was caused by radon. But you're right. In one thing like that, how many of the lung cancers in Iowa are among non-smokers? That would be an important piece of information. And so I don't know if somebody's done that paper, look at every state and see how many non-smokers have lung cancer and see if that correlates to the amount of radon in that state. I'm not sure if that paper has been done, but I'm glad you raised that. I've got a query mechanism through a peer-reviewed public literature that I'll see if somebody has done that study. Do you know?
I don't.
Dr.
And I was just going to say,
Dr. Fields would have been.
right. So we know obviously the number one reason for lung cancer is smoking, and the number two is radon. Is there a number 3 and 4 that's very significant in terms of numbers?
Lung cancer.
Yes.
The next one would be secondhand smoking.
Okay.
And then there is such a thing as third-hand smoking as well, which is the residue of smoke that's in the room. So secondhand smoking is you're in the room with someone who's smoking. Third-hand is you're in a room where there has been smoke.
Okay.
But those are the main causes. But it's a good question,
Yeah.
and so
In a way,
we can
almost.
take a look.
Yeah.
We also there's synergism. So a smoker who is exposed to radon, it's more than just additive. So even lung cancer in cigarette smokers may be have a contribution, a significant contribution, or it may even be the cause for individuals who have a smoking history and radon exposure. It may be the radon, not the smoking, that caused the cancer.
And it's up to 9 times the risk if
Yeah.
they're a smoker. Yeah.
Well, the American
Yeah,
Lung
and
Association
radon.
website in their state of cancer in Iowa says that 400 people die in Iowa every year because of radon-induced lung cancer. Now, I think that's a high number. It's a very high number, but I don't know where their data, their specific data comes from. That's something they list on their website. Nationally, 21,000 people die of lung cancer because of radon, as per their website.
Yeah, and I think that is a statistical
It is a high.
number using like the methodology you suggested.
I mean, it's the deadliest cancer.
George, did you have a question?
Yeah, and it's very close to what we're talking about right now. Is it believed that radon is playing a major role in this spike in overall cancer rates in Iowa, resulting in this number 2 ranking? And if not, is there a possibility that radon might be causing us to take our eye off the ball for what is causing this huge spike in cancers, giving us this number 2 ranking? Because there are some people that would like us to believe that it's because of binge drinking, as an example.
Mhm.
You know what I mean? Yeah.
Well, the Iowa Cancer Registry has reported on that.
Yeah. You
You go first.
I'll go
Yeah.
first.
Uh-huh.
I would say that when you look at Iowa and from 30,000 feet and compare it to the other states around us, what is different about Iowa that would contribute to Iowa being number 2, and not just Iowa being number 2, but the only state where the incidence is going up considerably. Now, there is one other state in the country where the incidence is going up, but it's a little bit of a blurb. And that's a state that has very low cancer incidence, but it's going up statistically, and that's the state of Utah. And many people believe that theirs has gone up because over the past few decades, they've had a great change in their population. So historically, their population, large majority Mormon, that did not smoke and drink, and that over the last couple of decades with the tech boom and the advancement of those sorts of industries in Utah, there's a lot more non-Mormons that live in Utah. And even though the incidence of cancer is quite low, it's gone up a little bit. So they're the only other state that the incidence has gone up. Whereas Iowa, it's going up sharply. And even Kentucky, that's number one, the incidence is going down. So it's not going to take very many years before Iowa becomes number one. So back to your question, what is it about Iowa that is different? Well, there's two things that seem to me obvious and probably deserve greater scrutiny. When you look at all the other modifiable risk factors, cigarette smoking, obesity, alcohol consumption, sun exposure, physical activity, all of those, Iowa's sometimes a little higher, sometimes a little lower, but not obviously standing out. But two things where Iowa stands out. Number one, radon. And number two, the amount of agricultural chemicals that are spread across our state. Those two things are significantly different than most of the other states. And I think that although radon's only been conclusively shown to contribute to the lung cancer issue, I suspect that we will find that, like other radioactivity and other radioactive substances, other cancers may also be affected. But the other area that I alluded to was ag chemicals, because Iowa's land, the amount of land that's under cultivation and modern farming is a chemical process. So there's no doubt that herbicides, pesticides, insecticides, fertilizers, nitrates contribute to the cancer problem in Iowa. And it's not that we haven't outlawed cigarettes. We're not going to outlaw ag chemicals, but we can't mitigate if we don't know. So more knowledge about the association. There was just last week one of the major studies that supposedly showed that glyphosate didn't cause cancer has been now pulled from the medical literature as being not a valid study. So we're having more focus on learning the risks of ag chemicals. We know the benefits. There's lots of benefits. Living in the modern world has increased the risk of cancer. We've got PFAS and plastics and carpets and food additives and red dye and all of those things. In some ways, they make living easier, but they also may contribute to cancer. So it's not like we ban everything, but that we learn the risks so that we can then mitigate.
Mm-hmm. And I'm not defending radon, but I don't think radon has increased in our ground. So in terms of something contributing to our increase in cancer, I haven't seen anything that would suggest that the amount of radon coming up from the earth has somehow increased. Mm-hmm. So
that's a good
obviously
point.
we still need to make sure we're not exposed to it. And January is Radon Action Month.
Yes.
Well,
National Radon
why
Action
do you
Month.
think you're here? Thank you.
We forgot to say that at the beginning, didn't we?
It's Radon Action Month. One more quick question. We're almost out of time.
This is more like an advertisement. It's fundraiser that Maria does and Above and Beyond Cancer does for the American Lung Association. Do you want to talk real quickly about that?
Do you see the fundraisers?
Yes.
Oh, well.
I think you're referring to Fight for Air Climb. Coming up. What's
Fight
the
for
date
Air
of Fight
Climb.
for Air Climb?
It's the last Sunday of March.
Last Sunday in March. Okay.
Yes.
Yep.
I forget the number of stairs we climb. And
So Maria has had a team every year for
we have the last 4 years.
4 years.
I didn't really, the first two, I think the first year was 21. So 5 years. This will be year 5, I think. So I make a quilt and I tell anybody who donates $50 to my Fight for Air Climb page can put their name in a hat. And I've had somebody win a quilt
haven't
the
won the
last 4
quilt.
years. So this will be, and I already have the other one, a new one started. It has a red, white, and blue theme, very patriotic, kind of like last year. So I need to start posting on that. And then we also raised money for the American Cancer Society Cancer Action Network with a bike ride across the country
Yes.
last in 20.
So Maria and Pat rode their
last
bike
year.
from Canada to Mexico,
Yes.
raising money for ACS Can.
Yes.
Thank you. Thank you for what you do.
Yeah.
Thank you for what you do. Thank you for being here this evening. If you know someone that would benefit by watching this program, it will be available on demand beginning tomorrow at the Above and Beyond Cancer YouTube channel and also the Mercy Cancer Center website. I hope you join us again next week. Thanks, everyone.
Thank you.
Thank you.